Hello, Dr. De Maio. It's lovely to meet you. My name's Chloé. I'm the Deputy Editor and Communications Manager at the Aesthetics Journal. So we are a publication for medical aesthetic practitioners working within aesthetics. We've got a readership of around 11,000 in the UK. So I'm sure they're going to be really, really excited to hear about your career and your experiences within aesthetics.
Okay, great. Thank you for inviting me.
So could you tell me how you got into aesthetics and then how you ended up developing the MD codes?
Okay, so in aesthetics I entered medical school to be a psychiatrist. And I thought it was very interesting to understand how people react to things. Then in the fourth year, I went into plastic surgery and I was fascinated. Then I saw how incredible transformation if we change some features on their faces and body that they weren't happy, how it changed internally. Then I thought, this is powerful. So I thought I will go towards this. And then I graduated. Interestingly, in mid-90s, the injectables were starting.
Yeah.
And we only had collagen by fixing smile lines. Over the years, I noticed as a plastic surgeon that only fixing lines were not enough. Then I started injecting around the face. And then it was when the 8-point lift came from. And when I saw that the impact of dividing into anchoring points worked, I said, okay, now it's time to map the face. So when I map the face, that's where MD codes came from.
Okay. And what inspires you in your day-to-day work?
Today is the reaction that the patients have when they see themselves in the mirror.
Yeah.
For me, after the treatment, when they look, sometimes it's the perception of bringing them back, like this, or something that they lost, and you have the opportunity with a minimal invasive procedures, with minimal downtime, you can rescue, the things that they lost and the unfavorable messages that they present over the years.
Yeah, sounds really good. And what are your key pieces of advice to aesthetic practitioners in the UK just launching their careers?
I think what is important is practice, practice, practice. Something that I learned is this. There are moments in your life that you have to understand that the patients comes to our offices complaining about things that they don't like. It doesn't mean that they're going to be happy by the correction of the tiny details. So it took me a while to understand that what's important is not to erase lines.
Yeah.
No, you have a crow's feet, it's okay. You have this line between your nose, it's not bad at all. What is important to change are the unfavorable messages of the face, right? And this is something that I would tell young injectors. Don't get stuck into lines. Lines are part of life.
Yeah.
What we have to try to change is if the patient looks tired, sad, unapproachable, do understand everything that is negative, that avoids people having this gap between what they feel internally and what they transmit. It's interesting that many people say, oh, I'm very rested, but every time people tell me I look tired, or I'm very happy, but I have this kind of severe look. So this, for me, is the formula for everybody that is a young injector to start paying attention and not to take decades to be aware as I was. It took me so many years to find it out.
That's really good advice, thank you. How would you like to see the aesthetics specialty develop over the next 10 years?
I think I would love to see this becoming mainstream, where everybody would be able to benefit from it. I think it should be something like teeth care, in a sense.
Yeah.
So since ever now we have better dentistry, and people forget that it's time also we can improve the skin quality, we can improve the elasticity, we can create structure. And this is something that people don't know.
Yeah.
Do you understand? So I think if this would be a dream to see everybody know, okay, medical aesthetics is part of life as brushing your teeth. This would be a dream for me.
And how do you think practitioners can support that development?
First, getting better themselves. Do you understand? They have to learn the best technique. They have to learn what are the alternatives, and they have to measure their success rate.
Okay.
So we are never going to be excel in everything. Do you understand? So that means every time that they are in their own upskilling, which is a lifetime, right?
Yeah.
We have always to get better and better and better to deliver better results and safety for the patients. And I believe that this big change is going to happen by the time that they understand their social responsibility. They understand it's huge what we can promote to patients nowadays.
Yeah, certainly. And what is your one sort of key piece of advice or motto that you live by in your work?
Wow. I love this quote that was written by Peter Drucker. I think he works in marketing. He said, the best way to predict the future is to create it. I love this idea because look, with technology, with great products, with MD codes, what we can have. We see the mother and the daughter. We see how aging process is. Can we access it and control it so that we have a better future, aesthetic perspective? And the answer is yes.
Fabulous. Thank you very much.